good evening, everybody. Good evening, ladies and gentlemen. Thank you so much, BW, for the amazing oncology summit. My name is Dr. Charu Arora, and welcome to all the panelists and all our guests, cancer survivors. I can see a lot of families. I think it's great. You know, when we talk about today's panel, it is extremely relevant in today's world. It is my humble pleasure to be sitting next to Anupam sir, who's been such a strong mentor in this field for so many years. And as the previous panelist, as Dr. Harit sir just ended his fireside chat saying that har treatment har ek ke liye nahi hai. So one size doesn't fit all. Although we read one textbook which had diseases and we read multiple textbooks for same problem, but still, especially in today's world when the innovation is moving at such a fast pace, one treatment is not the same treatment for everyone. And I think we have a panel, very diverse panel from pediatric oncology, hematology. We have geneticists and precision oncologists. We have women's health specialists, and we have a philanthropist and a cancer survivor as well. So coming to Dr. Aparna first, we'll start with you. In today's world, Dr. Aparna, the buzzword is genetic counseling. Everyone talks about genetic testing, genetic counseling, zarurat hai ya nahi hai. How do you feel in the past 1 decade, Indian patients have embraced this concept of genetic counseling and genetic testing?
So first of all, good afternoon, everyone. And thank you, Dr. Charu, for that question. So when I actually moved to India, which is around 7-8 years ago, there was a lot of resistance around genetic counseling, genetic testing. And we kind of went down to understand why was there a resistance. And it was actually lack of education. It was individuals and family members not understanding ki hum ye kyun kar rahe hain? Why are we doing the test? So one thing we learned that if a patient meets a genetic counselor in particular, undergoes a pre-test genetic consultation, in that you're actually explaining the testing about how it's important to them. When you do it in a non-judgmental, in an autonomous way of actually communicating to a patient as to why genetic testing could be potentially benefit for them, for their loved ones. When you empower them with that knowledge, what it does is it somewhere breaks the taboo, the shackles that come around with it, the negative connotations that are there with genetic testing. Because a lot of it is because, someone will say, अरे मत करो, अगर ये करोगे तो लोग क्या कहेंगे? या अगर आपको हो गया तो आपके परिवार में definitely होगा अगर ये genetic test.
We hear that a lot, yes.
Exactly. It's going to be like opening Pandora's box, but actually it's not. So you have to sit, understand, and what we do a lot in these consultations is understand what walk of life a patient's coming from. Everybody's coming from somewhere different, and their understanding, their cultural, religious, social beliefs are very different. So one thing that a genetic counselor, and I stress about this everywhere at a genetic counseling meeting, is you need to take all those beliefs, keeping that in tandem with it, and then explain genetic testing. Show them how it's beneficial to them. And then after that, if they say this is still not for us, then it's good. But I think knowledge is power. And once we've started explaining to patients, you can see that change happening. And today, a lot of time patients be like, when I be like, you don't need genetic testing. No, let's just do it.
So you're saying that they're proactive in asking for it?
Absolutely, because there's awareness. People are talking about it. Healthcare providers are talking about it. So that definitely has brought a huge change.
So knowledge is power. The first key take point is knowledge is power. Now, moving to the uniqueness, what Dr. Aparna said, I'll move to Anupam sir. So you have been a pioneer in transplantation, pediatric hematology, oncology. Treating a child with a cancer or with an oncological issue comes with a very unique challenge, because at one point of time, one set of patients feel that it's a child's life. You got to be aggressive because you have a long way ahead. The other thing is that if you be aggressive, you will lose out on the quality of life. With your experience in the current scenario, what do you feel is the uniqueness in managing a child in an oncological setting? Aggressive or quality of life?
Good afternoon, everybody. I'll I'll take you through the journey of my, uh, tenure of nearly 37 years in pediatric oncology and hematology, and then you'll understand what is the situation today. When I started in 1991, 92, the scenario was that very few people were there in the field of pediatric oncology and hematology. Even lesser than the people were the number of institutions which are handling pediatric oncology patients. And the awareness about pediatric oncology was zilch, zero. To this extent, my worst enemies were my own pediatricians. You make a diagnosis of cancer in a child, he would go back to the pediatrician who had sent you the patient, and the pediatrician, without talking to you or without even understanding, would say, "Acha, ab to chodo na, kya karna hai?" Okay. The other aspect is that there has been an improvement in the supportive care and other types of care which we need in treating these patients. But don't forget that two young couple who have brought that child to you are in the beginning of their career. And when they are in the beginning of their career, they are not really, they're not really able to cope up with the disease and with the expenditure involved. They don't have the bottom line, as we say, as we talk in corporate terms. They didn't have the bottom line to take care of a patient of cancer, although it was much cheaper at that time than what is today. With the result that it was either the grandparents or some uncle who was making the decision. And believe you me, I've heard this being said, it is going to be cheaper to produce another child than to take care of this child. I mean, it may sound very hard, it may sound very harsh, but that's the actual story. So that's the reality of our country. I mean, I do understand the previous session was about provision of a high-end hospital and all. But let me take you back to the whole country. How many people amongst us, and when I say not people in this room, but amongst us as Indians, can afford to go to a high-end hospital? The entry into that hospital is intimidating. Number two, your ability to reach that hospital is intimidating. Three, your ability to stay on for 2 years or 3 years or 4 years for treatment is well near impossible. So let's not fool ourselves into the fact that we are giving excellent oncology care. Till I reach the last patient, last man in the line, I have not done my job. And that's my issue at the moment. Dr. Aparna just now talked about genetic counseling and its ability and all. I agree with her that over a period of time, last 1 decade, genetic counseling has come up in a big way and we have been able to deliver it. The reason is that now we have drugs which target those genes. 10 years back, we didn't have those genes. We didn't have the targets for those genes. So once you didn't have, then it was, should I spend my money, which I have in my pocket, for a 1 lakh worth genetic test, which may be of no use to us because we don't have anything to treat that disease, or should I spend it on a drug or on the treatment of that child? So that's the issue. Now, with this, over a period of last 10 or 15 years, the whole thing has opened up. There are now a lot of people who are ready to donate. They are ready to do CSR, and with the efforts of Dr. Poonamji, things have improved, and we have reached out to a lot of institutions which were not able to do. We now have NGOs and we have systems in place where we can approach the government as well as the NGOs to fund our patients for treatment. But still, we have a long way to go. We talk a lot about Ayushman Bharat. I agree with you that Ayushman Bharat is an excellent, but where is the money? We now know that hospitals in Haryana, in Delhi are owed hundreds of crores by the government because there is no money there. So I think, as I say, we have to put up our money where our tongue is. The government has to put its money on healthcare. Healthcare and education are the two areas in which we have lagged behind drastically. And we have to put up our money in that. Until we do that, we are not going to reach the people we want to reach. The idea is, when I started my, what you call as the training sessions, training programs in the national board in 2004-5, people asked me, why are you doing this? You are ruling the roost. Why do you want to create competition for yourself? I said, देखो भैया मेरी बड़ी सिंपल सी बात है. आप एक सब्जी वाला, इट्स अ क्रूड एनालॉजी, एक सब्जी वाला बैठा तो एक ही है, पर 10 बैठ जाएंगे तो मंडी बन जाएगी. So I want to create a mandi in this society, so that people not only come from far and beyond, but they come from outside India also. So that is the difference we have seen. We have seen the drastic change. And today, let me tell you, at least in Gangaram now, we have nearly 60% of our patients being supported by some NGO, either Poonamji or some other NGO is supporting them. Not only that, we now have medical organizations, medical drug, the companies which make these drugs, high-end drugs, they're ready to give us the drugs free of cost. So things have improved drastically, but we still have a long, long way to go. We are just scratching the surface, as we say. We need to go much beyond that, and that will come only when there are a lot of people trained and are, unfortunately, whoever we have trained, they are stuck around in Delhi or in the big cities. But we need to go beyond that. But now I'm very hopeful that it will go beyond that, because there is near saturation in the city of Delhi. There are no posts left. And I have been telling my students, go to this place, go to that place. We'll arrange for a person to help you with that. So I think that is very, very important.
Thank you so much. I think that was very helpful, sir. Moving to Dr. Jyoti, this is the season of Navratri, and in Navratri we celebrate Shakti, the spirit of Shakti. And you being the lead of medical oncology at a women-centric, cancer care center. From my personal experience, when I came back to India, I faced a lot of difficulty in handling women in palliative care, because, as sir said, although it is nice to have a very strong family, it's nice to have a very strong connection, a lot of family members taking decision for you, interconnection, but it also works against you as a doctor, because there are too many cooks who are spoiling the kitchen. There are too many people, especially in a woman's life, who take decisions. So when you deal with a women's health, or when you deal with a person, a female patient in oncology, how difficult do you feel in counseling, convincing, and also kind of telling them that what is right for them, despite having such a strong family, interference?
Yeah, so excellent question. And so as you started, over the years, I've seen a change happen with my own eyes. Poonam ji may not recall, I'm from AIMS, and she started her journey from there. So 1997, 98, when I was doing my DM in medical oncology from AIMS Delhi. So the times then and times now, there's a stark difference. And there, what you said at that time, that was the truth, the fact that women were not allowed to make decisions for themselves, even though they were the ones at the receiving end of the suffering due to disease as well as the cancer treatment. But the times have changed now. And, I think it has been a collective effort. The awareness level, the education level has gone up. The doctors are also, the way you talk to the patient with, surrounded by other family members, that makes a lot of difference. So in my clinic, in my practice, when I see these women with cancer, you can ask them, I choose a team leader, so when I talk to them, when I have given them a plan, treatment plan, I then, sort of declare as to who's going to be the team leader. So it's never me or it's never somebody else in the family. I almost always propose that the patient herself should be the team leader, because she should be the one who should take charge of her health and her suffering. So that's my endeavor. That's what I aim for. And I've seen that that making a difference in the mindset, in the way it's taken up. So that uptake has also improved over the years, uptake of this suggestion. And now women are more coming forth. They share more their complaints, their side effects. They are hiding it lesser now, more vocal. Yeah. That obviously the kind of setup that we practice in now is also different from where I started my journey from. So that social strata is a bit different, but we as humans, I think we can relate to that. Our basically we are all Indians, so the Indian family structure hasn't changed. That remains the same. But I've still seen that change happen over the years. And if we try to empower the women more, they do tend to take it up, and they want to fight it out. They are basically, we are all, Nari Shakti and fighters and all. Who wouldn't want to, get well soon? And so I think if we empower them with knowledge, and I try to, when I talk to them, I talk to the patient directly. So that they get it, straight from the doctor. They get to know about their disease, their, sufferings, what's in store for them, both good and bad. So it happens, it succeeds more often than not now than before.
So, if I understand correctly, it is the awareness level which has increased in the last decade, which has led to more people being voicing up their issues and then coming up to the doctors with better counseling, right? Perfect. So, going from counseling to Ms. Poonam Bagai, being an advocate, being a cancer survivor, and also a philanthropist, you deal with people from all socioeconomic strata on a daily basis, whether it is doctors, whether it's institution, policymakers, or even patients and their families. What one piece of advice would you like to give it to the doctors when they are building up conferences and talking about hospitals for future, doctors of future, oncology in future? What do you think your patients and your people from the NGO, they actually say that this could have been dealt with us in a better way?
Thanks, Charu, and really glad to be here today. I heard some of the conversations before as well. And I was very delighted that when we talked about the hospital of tomorrow, everybody talked about the patient. So I'd like to leave us all with saying, let's talk much more about patient-centered care, and let's start demanding that all healthcare should be patient-centered. If we make it our language as doctors, as caregivers, as an advocate, we start telling people this is important, right? As a person with lived experience, and that's the other terminology, I'm a person with lived experience, that's the terminology worldwide, right? It's important for that person's voice to be heard. So the most important thing anybody should be able to tell a doctor to remember is that when you are talking to me, it's about me, not about you, not about my cancer, not about your hospital, not about what's the best protocol or the best drugs or the best test, but it's about me. So talk to me about me and remember to ask me what have I understood. Because most of the time I haven't understood. After you said cancer, I haven't understood anything you said after that. So how do you know that I've understood chemotherapy and genetic testing and targeted therapy and immune therapy and whatever else? So come back to talk to me and say, "Aap kya samjhe?" Right? I think very important that the doctor remembers, and if the doctor doesn't have the time, and in many of the hospitals we work at, I partner with 140 hospitals across the country. In many of them, I understand that doctors are busy. Make sure your coordinator, your psychologist, the team that you have with you spends that time to talk to the patient to say, what did you understand? What are you taking away? What are your questions? I'm talking like an advocate because I think this is what I need everybody to say this again and again. Now, what we did at Cankids, which is the NGO that I set up after you asked me, why did I come back? I came back to India to set up Cankids, to reach out to children with cancer, to make that difference. But we also worked on empowering the parents and the survivors. So today, for instance, in Cankids, we have over 5,000 plus members who are parents, who are survivors with lived experience. And what we do at least 2 or 3 times a year is we do these national competitions in which we teach the children to say, I deserve the best treatment, care, and support. If you want to touch me, have you washed your hands before? Can I ask you a question? Can you stop and talk to me? No, I'm not case number. I am the child. Can you? So I think a lot of the empowerment that we need to do, not-for-profits like ours can help, and we should. But the patient should have the right. And I'm going to tell you a little story. Many years ago, I was with one of my cancer survivors, and we were in the elevator of a Delhi government office. And I don't even know the name of the deputy CM then, but he walked in. And my cancer survivor said, we're here to ask for our rights. And the response was, what rights? हम आपको हेल्प करने के लिए, मदद करने के लिए बैठे हैं, आप अपनी हक की क्या बात कर रहे हो? बट है तो मेरा हक, है तो मेरा हक, और आपको सुनना पड़ेगा कि ये मेरा हक है. मेरा हक है कि मुझे बेस्ट ट्रीटमेंट मिले, मुझे बेस्ट सहयोग मिले, मुझे वो सब मिले जो यूनाइटेड नेशंस ने बोला. राइट टू हेल्थ भी मिले फॉर चिल्ड्रन, राइट टू एजुकेशन भी मिले, राइट टू चाइल्डहुड भी मिले, right to pain and palliative care. You talked about it, right? We're in a country where people are dying still. We want to talk, even my doctors like to talk about treatment and survivorship. We want to talk about hospitals of the future, but even in the hospitals of the future, till we don't get to those survival rates, we have a lot of patients who come in late, who come in misdiagnosed, come in wandering through many, many different places before they reach the best doctor, the best therapist. So do we give them? Most important, and thank you for having me today, is the right to be heard. As a patient, I want you to listen to me is the most important thing I can tell you. And you have to know, for a lot of the patients, you've been at AIMS as well, for a lot of the patients, you're the doctor, you're God. Maybe I can't ask you anything. Maybe you'll get angry with me. Maybe if I ask you something, you'll be impatient, or you'll say, why are you asking all these questions? And I anyway think my life is in your hand, you're God. But it's up to you to tell me you're not God. Dr. Harit talked very nicely about how nervous a doctor can be about the patients. But take the time. We're two human beings. We're two families. Take the time, talk to the patient. Let the patient tell you how they feel. The most important thing is not what is the right treatment. When I come to you as a patient, the most important thing is, how are you going to care for me? And that care, and therefore the right treatment, is not what protocol and what drug alone. That is important because of course I want to survive. Right. But equally important is how will it disrupt my family? What is it going to cost? Where will I stay? What will happen to the rest of my family? Who's going to tell me all this? And are you, the doctor, aware of the fact that my other daughter is getting married? Maybe the doctor doesn't need to know so much. I get it, right?
Because when we treat a patient, we always look at, especially in a patient of cancer, when we make a, as I say, quote unquote, protocol, that also should have not only socio-economic, but occupational, financial, marital issues. Or, children, what are their children doing? Are they educated, not educated? We actually create that. And then we discuss it. So I think that's very important.
So you said something important, and that is that every patient deserves a care plan. And my care plan is about me, is the most important thing you should know. But, and this I want to tell you the but, because I don't really think doctors can do the care plans themselves. Now we may say, oh, but we're in a low middle income country. But we have worked across the country in B and C cities. And when we provide the manpower, as Dr. Anupam, we provide manpower in the hospitals as an NGO, so that the social worker, the dietitian, the psychologist, the teacher, the patient navigator has the time to sit with the patient, understand from the doctor, and then work together with the patient and the family on a care plan. Now, this is something we can implement across the country and across cancer continuum. We do not need to think, oh, this can only happen at Apollo and Fortis. No offense meant to you on that. I think any hospital in India can do this. Provide the team, provide at least 2 people who will sit with the patient, understand from the doctors. Doctors can be busy, and make up the care plan, but my care plan is made with me. So that's my big piece for patients.
Thank you so much. Thank you so much, Poonamji. Now, she ended on bespoke treatment. And, Aparna, you head the entire precision oncology, which is all about bespoke treatments. And sometimes telling patients and, new patients, as I would say, जैसे मैम ने बताया कि वर्ड कैंसर होते ही उसके बाद कॉन्वर्सेशन एकदम इट्स अ बजिंग साउंड कि उसके बाद क्या है मुझे नहीं पता. How difficult it is for you to reassure people when they need to know that they carry a hereditary risk of spreading or giving cancer? A quick answer, please.
Yeah. So one thing is, your genetic testing is not your destiny. A lot of times that's the biggest misconception.
I want that to be retreated again.
Genetic testing is not your destiny. Just because you test positive, it does not mean you're going to get the disease. It's information. Information is power. And most important of all is reassuring your patient you are not alone. There are a lot of individuals who are actually going through a similar journey or have been through that journey with you. There are medical healthcare professionals. It doesn't mean you see me today and that's it, you don't see me again. We're all there in your corner, and that consultation has to be filled with empathy and, most importantly, listening to your patient. As I said earlier also, I need to know where my patient comes from, what my patient's understanding is, and that's how I would be talking to them. Like, it's very important in telling them, because you have this knowledge, this is your power, and that's my main key. When they walk out from my clinic, they understand they're in charge. And there are times when I think a patient mentally, as Dr. Poonam said, that sometimes after hearing the word cancer, your system just shuts down. My first assessment is to see how receptive is my patient. Sometimes I'll just say, you know what, let's chat today. Forget genetic testing, forget everything. Let's chat. How are you doing? Who's with you today? That's very important. Once I've crossed that and I know my patient is receptive, my patient is ready for this, not the patient's family, my patient. That's my primary concern. And yes, the caregivers are equally important, but I need to know my patient's on board. Then from there, you take it forward. Your patient should know you're their friend. You're there to listen to them.
So from patient being the team leader, as per Dr. Jyoti, to patient being a friend and to listen to the patient, my question next is to Dr. Jyoti. You've worked in the national hospital. Now you're working in a private setup. Both seeing different type of patients. Absolutely different set. 10 years, 15 years, decade has changed, innovation has come a long way. What 3 key points you think when you decide what is a right fit for your patient? What treatment is a right fit for your patient?
So I think this is the most important question, the right treatment for that given patient, So one may choose to talk about precision oncology and comprehensive genomic profiling to come out with the best possible drug treatment plan for a given patient. But as already emphasized, it's not just the treatment, it has to be holistic, and therefore it has to go beyond that protocol selection. So in my practice now, more often, so it's not just the disease characteristics as defined by the comprehensive genomic profiling, it's more to do with patient characteristics. So not only patient's age, performance status, the presence of comorbidities or other illnesses, the drugs the patient is already on for those illnesses, it also encompasses the financial status, the family structure, the support system. So actually in choosing that, in devising that right treatment for any given cancer patient, we do take into consideration all this. So how much is the contribution of all this into the decision making? I think all these are important for any strata, any setup, be it government setup, corporate setup. These factors would continue to be important, according to me. Nobody has, if that kind of money or that expensive treatment is not really required, I would not advise that, right? And we have to, as we say for health, go in for seasonal, fresh fruits and vegetables. Don't we say that? Yeah. So similarly for cancer treatment also, I believe that we have to first go in for what's easily available, easily accessible to a vast majority. So that the basic principle must not change.
So
for we are dealing with human beings here. We are not treating, guinea pigs. So that basic principle, I think, should remain the same.
great point, actually.
So-
Look for the giraffes and zebras and then move to the unicorns.
Yeah. So that treatment has to be right fit for that given patient,
Person.
right? Not
Just a
Yeah.
blanket.
So we do talk, we do offer, we come out with options, and then we let the patient choose.
So a cafeteria approach with a care plan in place. Perfect. Sir, being a pioneer, again, you have seen generations of oncologists being made. What do you feel should be the one lesson for the new oncologists, keeping in mind the innovation, keeping in mind the information transfer, and also keeping in mind the importance of imparting information to the patients?
I think, first of all of us have to learn to be empathetic. It's a key thing which you have to learn. And we have to learn as to what is the expectation of the patient. And when I say patient, it's the family from you. And what is the level of functioning of that family? I'll give you a small example. We now are reaching nearly 85 to 90% cure rate in leukemias in children. But that's with high-end treatment, with intensive treatment, with plenty of blood and blood components and other things thrown in, and it goes expensive. Now, if a patient comes to me who's from a small village, say in Bihar, which is very commonly we get patients from Bihar, UP, etc. And I talk to him, okay, we will do this, we'll do that thing, and I know that he cannot really afford it. At the back of my mind, I have that he's not going to be able to afford it. He agrees to it. Okay, I start the treatment, and a month later, कहते हैं ना उसकी फूंक निकल जाती है और वो बैठ जाता है, और वो ही नहीं बैठता, उसकी पूरी फैमिली बैठती है. वो अपना घर बेच आता है, अपना फार्म लैंड बेच आता है, आपके पास आ जाता है. उसके 2 महीने के बाद ही से मेरे तो बस हो गई, अब मेरे से नहीं होगा. Now, with that treatment, I would have reached 85% cure rate. But if I had a simpler treatment, I would have reached 50-55% cure rate. Now, this is very debatable, whether I advise that patient 55% cure rate or 85% cure rate. But if you look at it retrospectively, perhaps that 55% cure rate would have been better with just an injection thrown in every month or so, and his getting that treatment in his own state, in his own district. So I think we have to, till we reach that level of maturity in our medical sciences, in our delivery of the medical treatment, until we have enough NGOs supporting these children, we really have to make that decision. And that decision can only be made after knowing the family and knowing the dynamics in that family. It cannot be made, I can't make it by looking at a patient and seeing what that patient is wearing or not wearing, and I make that decision. No, we have to explain it to them and then go ahead and move. Unfortunately, the problem with children is that they are not the decision makers, and it's very, very, very difficult to make that decision with the help of the parents or grandparents or somebody of that sort. That empowerment to the children is not that much. Yes, in a bigger age group, say 10 plus, the empowerment is there. Although now we know that we can explain even death to a child who's 5 years or 6 years old and get them, take them through the journey of life and make them comfortable in their last. But still, it is still a very debatable issue as far as our children are concerned, because they have never been through the milieu of making a decision themselves. So the theories, we talk about Kubler's theory of death and all those things at various ages. They are theories for the Western world. What we have to implement is, in the scenario in India, what is going on. आज भी मैं अभी कर रहा था, we talk about AI and we talk about other things in screen time of children. Believe you me that there's an epidemic of autism and learning disability and ability to interact of the children with the adults.
Absolutely.
And that is because of the absence of family time in our families.
Lost human connection.
There is no grandfather, no grandmother, no mommy, tai, chachi, anybody in the house who can interact with the child and sit down with the child and spend time. So I'm getting scared with this innovation of AI coming in. We have to overcome it. We have to learn to cope up with AI. We cannot just give it to our children and let them go rampant with it. So I think everything has a positive and a negative side. And I've just told you that in children, we have a totally different scenario from the West and in our country.
Thank you so much, sir. So, with the respect of time and Aditya's eyes looking at me continuously, there are so many questions. Our panelists will be here with all of you for the next few minutes after the session. I think a couple of take-home points are that there is no one treatment for all the patients. A care plan should be made with patients and families' issues kept in the center. A good communication should always be done. Friendly environment should be created. And do not think that women don't take decisions for themselves, because they can voice it if given the right opportunity. So I think, thank you so much, my fellow panelists.
Charu, I'd like to actually add one part that we've missed out in this discussion about choosing the treatment, the right treatment for the right patient. And that's really around policy, right? And I think it's very important for us to talk on the panel about the role of the government. You mentioned it a little bit, right? So when we're talking about access, right, we have to talk about What is the policy? Where are we going with access to care? Where are we going with universal health coverage? And so while you mentioned the Ayushman Bharat, universal health coverage, financial protection, I can tell you the difference it has made across the board. We are a gap-filling organization and we're a leveraging organization, which means if I give 20,000 rupees for the test, then the family is able to get to the inpatient care and get 5 lakh rupees from Ayushman Bharat. The teams that we provide help the families access the care that the government systems provide. So in my book, I see it. I see us giving 3 lakh rupees a child earlier, and now we're giving 10 or 15 or 20,000 because more and more of the hospitals across the country, B, C, A cities, everywhere there is a better access to care. When we started off mapping access to care, we were at about 29% children are accessing care. Today, we're able to actually see 53% children are accessing care.
That's wonderful.
And we know that by 2030, which is our WHO goal, we will get to 100% access. We will get to 100% financial protection, provided we as a society understand whose role is what. Your role is to provide the best genetic testing. Your role is to bring in precision and all the best treatments in our country. My role as a patient advocate is to make sure I can get it to any child or any patient in the country. If I do my role, the government does their role, the best of best doctors do their part. I don't see why our patients should feel, oh, we live in a low middle income country, so all the people who get cured are in USA. That's not okay. Thank you.
No, absolutely right point. So, Badalta Bharat, Naya Bharat, and I think it's a time for new India. So, thank you so much for bringing light to that as well. So, thank you so much, fellow panelists. On a positive note, let's end this panel, and thank you again, BW, for organizing this discussion. Thank you.